Hello, everyone. Welcome to the Agent and Broker Panel, Conversations from the Field. My name is Blake Carlton. I'll be introducing your moderator, Lisa Wilson. Lisa is the Senior Advisor to the CISO Director on External Affairs. She has been with CMS over 15 years, working on Part D and CHIP implementation. She began her career as a Presidential Management Fellow. With no further ado, here is Lisa Wilson.
All right, now that we've gotten the technical difficulties out of the way, we will embark on our panel. So let me start off by introducing our panel. We have an awesome panel here. I'm going to go a little out of order. I'm going to introduce Sonia Pearsall first. Sonia is a broker and client advocate. She has been licensed to sell insurance since 1983. She's licensed in New Hampshire and Massachusetts and has been registered with the Marketplace since its inception. Next is Stan Sinowski. Stan is president and founder of Insure One Benefits 2001. Stan has been a licensed broker since 1982, currently holds a license in Ohio, and has been registered with the Marketplace since 2013. Dave Taylor is a health insurance agent licensed since 2010 and a registered financial consultant. Dave has registered with the Marketplace since 2013 and holds an active licensure in Florida, Texas, New York, and Rhode Island. Next is Yvonne Warren. Yvonne Warren is an individual enrollment and Medicare specialist. Yvonne has been licensed as an agent since 2012 and registered with the Marketplace since it went live in 2014. Yvonne currently holds an active license in multiple states, including Nebraska, Iowa, Kansas, and many others. Next is Trish Freeman. With over 25 years of insurance benefit consulting experience, Trish leads an experienced team servicing clients in the great state of Louisiana. Trish is serving as the chairwoman of the board for Health Agents for America and a member of the National Association of Health Underwriters, and serves on the Insurance Agent Advisory Board for her local Commissioner of Insurance. And then finally, we have Guy Fury. Guy is the owner of The Insurance Source, an independent insurance brokerage specializing in health insurance. He has been working in the health insurance business for 23 years and with the Marketplace since the fall of 2013. His focus is in South Carolina. So thank you again for coming today to hear the conversations from the field. As Blake said, I'm Lisa Wilson. I have also been with the Marketplace since its inception, and in fact, since the pre-dawn, when it was passed as the Affordable Care Act in 2010. I've been working on these issues since the beginning, and one of the best parts of my job has been working with you. I have just been amazed at the entire time at the dedication and the commitment that this community shows. What's really amazing, though, is that it's the dedication and the commitment not just to a job, but it's the dedication and commitment to the consumers and the families that you serve. So let me first start off by saying thank you for that dedication. I really appreciate it and have had the pleasure over the years of working with you, on a lot of technical assistance. And I have seen how you work doggedly for your clients and making sure that they can enroll in the plan that is right for them and their family. So what we're going to do here today is really focus on that conversation that you have with your clients. It's probably one of the most important decisions that a family makes every year, both for the well-being of their health and their finances. And so we want to hear more about what that's like when you're sitting there with your clients and how you can better serve those clients. So without further ado, let's dig in. We were just going over in the back in the green room about how we're going to do this. We're going to have a different person start every time. I'll kind of choose it at random and then let other folks chime in as they so feel moved. But I really do hope that everybody answers this first question because I think it's such an important one. It's one that I've been the most excited about asking. So, Dave, can we start with you? Great. So what is one of your proudest or most memorable moments as an agent and broker working with Marketplace consumers?
I think it would be because, everybody hear me okay? There we go. Okay, that better? Yes. Okay.
Like I said, now that we've gotten the technical difficulties out of the way.
Well, I think one of the first things, since we're the face to the consumer, I had a client a long time ago that was before the Affordable Care Act who had systemic lupus. And I'll never forget it. His name was David also. And his words to me were basically he was falling apart. And he needed consistent medication all the time that was not cheap and consistent medical care and tests every month. And I got him one of those indemnity plans, the best you could do, the guaranteed issue plans back at that point in time. And that was the best we could do, really, because no insurance company was going to write him. And then along comes the Affordable Care Act with no pre-existing conditions. And when I called him up to get him coverage, he was ecstatic. And this was not a young guy. This was somebody in their late 30s. And he had been through a lot. And so he was able to go to a doctor, get the medication he needed, get the tests, and it cost him very little because obviously with systemic lupus you can't work that much. He was only working part-time. So he had a huge subsidy and he got everything he needed. So I think that's one of the most memorable things that I ever did. And he stayed in touch with me for years. He's since moved out of the state. But his life completely changed because of the Affordable Care Act. So I think that was my defining moment.
That's an amazing story. Thanks for sharing. Yeah, worth a round of applause. Trish?
I think one of my most memorable moments was, so I had a family that was paying roughly $2,000 a month for insurance, and this was maybe year 2 or 3 of the Affordable Care Act. And when I started asking very specific questions about how their income was calculated, we were able to save them about $1,400 a month. And it just changed their world, changed their whole world. So, I think when we bring the knowledge of, the subsidies and how the premiums work with the income, it really can change people's lives.
It's amazing. Yvonne?
Can you hear me?
No.
I guess use yours.
I think for me, one of my proudest moments was recently, I think more so this year. I have several, but this one stood out this year. A gentleman would recently let go from his job. His COBRA had expired, but he was disabled because he had been injured on the job. And between COBRA and the Marketplace, we were able to get him subsidies, but there was something that happened between his enrollment that it didn't capture. So the gentleman had about $1,400 per month in medications, and he was also high risk because of infection. His enrollment hadn't gone active. We hadn't got the appeal situated, and I was able to work internally with some CMS staff to get something resolved. But ultimately what had happened is the gentleman was placed into emergency services. He was intensive care, blood clot in his lung, and nearly died. But luckily, we were able to get everything resolved, retroactive effective date. So I guess for me, just making sure that I stayed on the ball saved his life, essentially.
That's amazing.
So.
Sonia?
You want this one?
Hello?
Yes.
Okay.
One of my proudest moments of working with the Marketplace is anytime that we're able to help a client get what they need is my proudest moment, because we have a big responsibility. People have all kinds of medical problems that need care, and the affordability factor, the Marketplace helping them to be able to afford coverage has been incredible. Many people were able to get coverage that couldn't afford it before. So I have been very pleased to be able to work with Marketplace and get people coverage.
That's great. How about you, Guy?
Is this on?
Yeah.
How about that? First, thanks to the Marketplace for having us here. It's a privilege and an honor to be here on this panel. And thank you all for coming. My proudest moment, honestly, is kind of like a 80s disco song, I Will Survive. I mean, so my proudest moment is survival, because what we do really matters. What we do can change a family's life. And the products that we have, the value that, I guess I went over. The value that we have as independent insurance agents cannot be overstated. This is an abstract product that people don't understand. And it's because of you that you can describe that product in a way that they do understand and help them make the choices that truly affect their lives in a positive way. So I am so proud to be an insurance broker. I think the role that we have is incredibly important. And honestly, I also think we should be compensated all the time for our work, not just during open enrollment. That's just my opinion.
Thank you. And Stan?
Well, thank you. After these last two responses, they stole my thunder. I would say that every day is my proudest day. I have the good fortune of having an agency where we've got 7 licensed agents, and if you asked every one of them what we do, they say we help fill needs. You'll never hear the word sell somebody something. Those of you that started in 2013 can remember quite an interesting first year that was, where there were a lot of things that didn't work right. So I think if I was to be specific, my proudest moment actually has 2 parts. The first part has everything to do with the fact that the initial enrollment period had significant flaws. And one of the flaws we actually got healthcare.gov to admit had everything to do with 2 families that had 2 sets, each had a set of twins, both girls born on the same day. Everything went through, subsidies were approved, carrier could see that there were 4 people that needed to be insured. However, the government didn't see it that way. They only picked up on one of the 2 sets of twins. We actually got healthcare.gov to admit when they initially programmed, they did not program to recognize multiple individuals born on the same day with the same birth date with the same name. And it was because of the relentless effort, and here's the other reason I'm very proud, of my daughter, who got healthcare.gov to admit it. The day they admitted it was the day they corrected both situations after we had tried for over 3 months. So thank you.
Thank you. I mean, I'm already hearing the themes that I've heard the entire time that I've worked with your community, which are, your commitment again to these people, to helping them get the product that is right for them. What's so important is that you bring this professional experience, your training, your knowledge to the board, and you're able to work with them to both give them the understanding of the product, but also help them with the nuances. So thank you again for all of that. Let's go to another question. What do you believe are the most important considerations when assisting consumers with Marketplace coverage? Yvonne, can we start with you?
Sure. I've taken some notes here, but I guess I need to go from my heart. All of us do the same thing. all of us are out here for the same reason. I don't think any of us sitting in this audience right now or up here at this panel discussion are in it for the money, certainly. To me, you've got to be the advocate. They can't advocate for themselves. Sometimes they create more problems than they know that they're doing, but I truly and honestly, wholeheartedly believe that is why we're here. That is why we do what we do, is to make sure that each and every one of those people that we talk to every single day know that they've got somebody in that back room ready to go to battle for them, whether it's on the carrier end or whether it's through the government end. We have to have their back. And to me, that is the most important thing that I do every day, is just to make sure that they know that they've got somebody to turn to when they don't think they have anybody.
So important. Sonia, did you have thoughts?
I wholeheartedly agree with you, and that's why I get up every single day, is just making sure that people have the products that meet their needs, the affordability factor. We have to make sure with all the limited networks that are out there, that, it's very hard to find plans that have all the doctors, all the hospitals in the plan, so we have to make sure that they can get continuity of care, that they have access, that their medications are covered, and not only that, that their claims are being processed correctly. And, making sure that their documents are uploaded to the government so that they don't lose coverage. So there's a lot that we do, and I think I said it earlier, that we act like attorneys, because if they have claims, somebody who has a $30,000 or $40,000 claim, an attorney isn't going to touch it. They're going to say it's too small, there's no money for me to be made. We do that. We take that on for, $20 a month that we get. We get on the phone, we go line by line, make sure that the claim is processed correctly. We work with the carrier, making sure that it's done. In a lot of instances, we can get that claim resolved for them, where they would probably just lie down and cry.
Yeah. Your expertise paired with that commitment is just so important.
Yep.
Others on the panel?
I would just offer that we speak of marketplace and we speak of individual coverage, but quite frankly, we're in the people business. It's all personal. Product's just the outcome. And I love the word advocate. That's a great word. I would just offer that in dealing with individuals, I think first and foremost, we have to have empathy. Second, we have to put ourselves in their shoes. And then lastly, never assume anything. Don't assume that they know what we're talking about. I think someone said in a prior meeting, we have to learn to speak different languages. We may have to explain the same thing 6 different ways for it to finally resonate. So again, I think advocate is a great word. We should, I think, add that to all of our cards.
Absolutely. Let's go. Guy, did you have a?
So I would say one of the most important considerations, and this is kind of important because our lives, let's be honest, during open enrollment, there's no work-life balance. Is that a fair statement? But it's not about us. It's about the people we serve. It's about them. It's about trying to help them make one of the most important decisions. And I think one of the things that Stan mentioned, empathy is important. The Affordable Care Act is not a one-size-fits-all law. One of my meetings at 10 o'clock might be from somebody who had cancer and now has health insurance for the very first time. The 10:30 meeting might be somebody whose rates have literally tripled and their deductibles doubled. So the empathy that you mentioned is critically important, and we have to be able to put ourselves in their shoes.
So true. Any final thoughts? What are the most significant lessons learned from your experience? I think some of you have touched on this a little bit, but are there other questions? Trish, do you want to?
Yeah, I think it's very, very important, just like Dave said, the income information that we put in is so critical. And we do have to provide empathy sometimes at the time when we tell them their premiums, because when you make a little bit more, you pay a little bit more, right? And sometimes they don't understand that. So a lot of times clients will come back and say, well, what if I just do this? No, let me tell you what'll happen if you do that. So it's very difficult sometimes to always do the right thing, but we as insurance agents and we as the advocates for the consumers have to always do the right thing and always list the right information, because in the long run, you're helping them. So it's never about, you know, the quick, low premium. It's always about doing the right thing and helping your client long term. So I feel like that's probably one of the most important things. Don't put a comment in the wrong place, because it can mess the whole application up. I mean, there's so many little things that can affect, you know, the outcome. So just be very meticulous, be methodical, always do the right thing.
Such great advice. Others want to chime in on significant lessons from working in the marketplace?
So my most significant lessons, I've just got a few, just stream of consciousness. I think there was a Seinfeld episode that said, "Serenity now, serenity now." During open enrollment, that can kind of be an important thing to keep calm. The second thing is document everything. I've kind of learned that is a necessity. And the third thing, and this is something that we all know, but it's important to keep your time during open enrollment. We have 45 days. Some of us have thousands of people that count on us in those 45 days. Your time is all you have during open enrollment, so keep that focus.
That's very important. Great advice. I was just saying thank you to someone in the audience earlier today, because you know we know that you put in a lot of long nights and weekends, and want to acknowledge that up here for all that work that you do. Great. Other significant lessons, or another? Oh, go ahead. Yeah, Yvonne.
Is that one yours? Okay. One other thing that I want to mention, and it's not necessarily specific to time management or income, but I think it has more to do, like, when you actually have to pick up the phone and call the marketplace. I've learned over the years that if it doesn't sound right, question it. Ask for a second opinion. And if that one doesn't sound right, ask for a second opinion. A lot of times when we call in, we know the answer, we just need somebody to validate it for us, or we need somebody to help us get through to the next process. So that, I guess that would be the advice I would give, is if it doesn't sound right, question it and just keep going until it sounds right.
It's another good example of how you're doggedly representing your clients. Does anybody have a situation that they may want to share? One thing that I think is hard is sometimes folks are, you know, sort of in your own office, and sometimes it might feel a little lonely or a little bit like you're an island when you encounter something that's a very difficult situation. So we thought that it might be helpful to share a difficult situation you encountered, sort of how you handled it, and then some thoughts on, you know, how you could do it again differently, either from, you know, thoughts, folks on the. Yeah.
So I had a situation, I enrolled a client on November 9th and enrolled her in a plan, and unbeknownst to us, on November 11th, the client was retroactively canceled for non-payment of premium, and so you know how that 90-day retro goes back. So what happened was the carrier negated their application for the following year, and we found out after open enrollment had ended. So we went in, we got a special enrollment, and what happened, the carrier once again threw that application out. I called the marketplace, we did another special enrollment, and once again, the carrier threw it out. So I enrolled with the help of Mr. McDermott at CMS, and Mr. McDermott was able to follow that. Now, it did take until March 1st, but it was retroactive to January 1, and then we were able to also find out what happened to the client's payment. The client had made a payment based on what she had been told to send in by the carrier. The carrier didn't understand the 90-day retroactive and had given the client wrong instructions. The client sent in the premium payment as they were advised to do, and the carrier applied that payment to a completely different account. So without Mr. McDermott's help, I never would have been able to figure that out. I never would have been able to get this client situated for 2018. So I was very grateful for the help that CMS and the Marketplace gave me to assist that client, and that client was very thankful for all of us as well.
Thank you for sharing that. You know, again, it can be really stressful to be in those situations where you're the person's, you know, back and forth between the Marketplace, and we appreciate that you're able to continue to work towards resolution for those issues. Thank you, Sonia. Others?
So I have two quick ones. One, kind of along the lines of a little bit similar to what Stan had said. I have a client that I've had for years and years and years. She has several kids, and she has an estranged ex-husband. And so I've had her insured prior to the Affordable Care Act. Then we enrolled her in the Affordable Care Act, and she got a subsidy. And then all of a sudden, she gets a letter from her certain carrier saying that her insurance has been canceled. And she calls me and she says, "What in the world?" Well, it turns out this ex-husband had actually claimed and enrolled the children under his plan as well, which he had just done several years after open enrollment had begun. So I don't know why they canceled her plan, but that was a mind-boggling situation that took a lot of time to realize what's actually happening here. The second one.
And you know, Guy, I would stop there and just say, one of the things that is amazing is how personal the relationship is that you have with your clients. You know, you're involved in the most intimate details, the finances and the family composition of their lives. And so you are able to take in and ingest a lot of information and sort through it and make sure that they end up in a plan that's right for them, which is really speaks a lot of volumes to the work that you do, and then continue to do once, you know, any issues may arise as a result of that.
And I'll tell how I solve these problems after I tell you the second one. This year, I had a client, I've had him for years and years and years. He passed away on February 3rd. And so we called the Marketplace, we gave them a copy of the death certificate. The client, the grieving widow conference called with us multiple times to the Marketplace. And unfortunately, he was still on the insurance as of June. Even though the client, who's a grieving widow, had spent literally days talking to the Marketplace. And, you know, so that we need to clean that up a little bit. But how I was able to get it cleaned up, because it's not me, I had a tremendous, shall I say, champion in Dean. Dean got both of those issues fixed in one day. I mean, we're talking, Dean is a rock star.
Yep.
Well, you know, we echo those kudos. We think the same about Dean and the entire team that works on agent and broker issues. But, you know, and there's another kind of layer upon layer behind that are working diligently on our side when you do have problems and you do need to call. So we're proud to be part of a team together. Let's talk about resources. What resources would you recommend to agents and brokers to take advantage of to be successful in the Marketplace, and why? Anybody want to go first? Stan?
Well, we've had a great day of hearing about many of the capabilities that not only CMS is looking to make available to us, but vendors are also looking to make available to make a difference, simplify, expedite. I would offer that when we started the agency in 2001, the first thing we did was we invested in our first version of a CRM. The ability to capture information, capture it historically, capture notes, conversations, paper documents attached to files, has over the years proven to be the most significant investment we've ever made. And over the years, we've enhanced our system so that it not only is providing us information that's recorded, but it also can be used to churn and create organic opportunities from a marketing standpoint. My agency's never bought a lead. We have enrolled some 60,000 individuals over the course of 20 years. They're not all on the books, I wish they were, but we know that duration is very short. But the good news is that that information in that CRM has information about not only their contact information, but birth dates. So immediately when we have somebody that enrolls in a ACA or marketplace-based product, we're going to track that individual until they turn 65 and hopefully be the agent of record when they transition to Medicare. So I would just again offer to you that from a resource standpoint, our CRM is our most valuable resource in acquisition.
So during open enrollment, we usually we touch every single client. It doesn't matter if you want me to touch you or not. I touch you because everybody's situation changes every year. So one of the things that we found a couple of years ago was an online booking system. So we schedule calls every 15 to 30 minutes with each of our clients. So super, super important that you have a plan. We're old school. We're very methodical about how we do things, but every file is touched during open enrollment. The other thing that I would suggest is you need to join a good agent organization. You need to be able to network with the people in this room, because I might not know everything there is to know about a client who has immigration issues, right? So I could reach out to one of my friends that has that information. I can't know everything. None of us are expected to know everything, but we all know somebody who does know somebody. So I would definitely recommend that, we guys all band together and help everybody out.
Other thoughts?
So the question was about resources, I think. Dean and his team, wonderful, absolutely wonderful. The partners for the agents, we're hearing about EDE while we're here. That really can make your life a lot easier. Third, I would say surround yourself as much as you can with positive people, because we really do need to be enthusiastic about what we do every day, because if we're not, we can't be effective. And then finally, join all agent insurance organizations, including those that might have health agent in their name.
I also want to take this moment to refresh people's memory on the technical assistance that CMS provides. I know I work frequently with Dean and Cheryl and the rest of the crew on webinars that we put on a regular basis. So I encourage y'all to come to our agent and broker website, check out when the next webinars are. They're a great resource. We also, during open enrollment, offer office hours, even on Saturdays, throughout open enrollment. So that's an easy way to jump on the line with us and get some of your questions answered if you have something that is troubling you. We also have a series of on-demand learnings. There are a series of videos that are also available on the CMS website. Because I know that, taking this kind of time out of your day, first of all, it's a little bit easier, during the off season. But if you have specific issues that you're looking at, during, open enrollment, you may be able to sit down and just ingest a short video versus spending such a chunk of time with us, which we really appreciate. And then finally, we do have a ton of FAQs on our website. So if you need any links to that or other materials, feel free to touch base with any of the CMS folks and we can get you pointed in the right direction. So I think we're going to end on what advice would you offer to a new agent or broker working in the marketplace? So go ahead, Sonia.
So I would say that you need to know all your products and all the procedures that the carriers have for submitting business and making their payments. Use broker tutorials, and if there's anything that you don't understand, just to pick up the phone and call the marketplace, and because it'll save you a lot of time in the long run.
Absolutely. Others, Dave? Sorry.
I guess this would be more on the line of building a book of business. I think that what a lot of agents start to do when they first get into business, they go out and they just buy massive amounts of leads if they can, and they start making massive amounts of phone calls, and they forget about the easiest way to do it, which is on referrals.
Right.
And so what I think is once you've built up 10, 15, 20 clients, start going back out to them. Most times, everybody who's a client, as long as you've done a good job for them, will give you at least one referral. So when you're starting out, it's an easy way to double your business a couple of times. And don't be afraid to ask for a referral. You know, ask for it. I always ask after a new client signs up with me, I always ask them, is there anybody else that you know that you think I can help? And I love when they call me up out of the blue. It's a Saturday afternoon. And they go, hey, Dave, this is Sherry. My friend needs insurance. Would you mind if I gave her your number? You know, who in here, anybody in the room is going to say, no, don't give her my number. I don't want to hear from her. You know, but I love when they do that because it means they're thinking about me. So I push people to do that. And I've built my business probably in the last 5 years completely from referrals. No more leads or anything like that.
Again, great relationships. Trish?
So I just want to go back to, reminding everybody that you always have to do the right thing. So, we receive phone calls. There is a girl that I have actually never written her insurance. She calls almost every year, and we compare plans, and I always tell her, you really need to stay on your group plan. That's going to be the best thing. And by me telling her the truth and not trying to make a sale, what ended up happening is I think she's probably sent me 200 people over the past couple of years, just because she knows that I'm going to tell the truth. I'm going to tell them what they need to know. So regardless of what, always do the right thing for the client, always, whether it comes to inputting income or, making a sale. Just always do what's right for your client.
Thank you. Stan?
When I read the list of questions and got to this last one, my first response was run, but then I
Come on.
I thought I needed to expand on that a little more. Those of us that are here for a very specific reason, reasons that have been mentioned by my cohorts here. We care about people. We want to do the right thing. And with that in mind, learning product, learning the rules and regulations, having systems, capabilities, they're all very important. But I also believe that we all have the ability to serve as mentors. And I would love to receive a call from someone looking to get into the agency, have them come by the office, and just let them listen on the phone. Just let them listen to how the office reacts to situations, to ways individuals handle things, different ways they say things. I don't know about you, but I don't think there's one of us in the room that would turn that person away, because we want, as it's been said, we want to do the right thing.
Yep.
There's enough out there for everyone. And the more I think we take a level of responsibility to ensure that these young agents coming in are doing the right thing, the more the government will look at us as true advocates and look at us as the true solution versus all the other approaches that have been taken.
I appreciate that, yes. Guy, and then Yvonne, and then we'll wrap up. Yvonne?
I'm going to piggyback a little bit off what Sonia said, and it's really stay up to date with your plans, your products, your networks, your carriers. It seems like every year the carriers change their networks. It seems like every year they change where you can go to the doctor. It seems like you're in network, you're out of network. That's one thing that I would really say is going to have the largest impact on your clients, is if you sell them the wrong plan and they can't go to their doctor. So knowing that is probably one of the biggest things, is just staying up to date with new ACA laws as they come out, new mandates as they pass. Those
Yes.
are huge. And what's going on in your state, too. So
Absolutely. Well, thank you to the panelists for being here today. I think that you have each said so much about the work of agents and brokers, the importance to American families and individuals, and the health and well-being of their family for the whole year. I want to just kind of go back and summarize a few of the main points. I think you've done it very nicely here in the last session. It sounds like that some of the most important things are the personal relationship that you develop, that empathy, that comfort with being able to talk about these very personal issues around somebody, then bringing your technical expertise and know-how, whether it's the products or the rules and regulations. And then that diligence that you have in representing them, whether that's through, appeals, or whether that's through, looking through their claims, or it's, through calling us and reaching out when you need help. So thank you for all of that work that you do, and we appreciate it, and to everyone here in the room. And with that, we'll conclude this session.
Thank you.
Thank you.
Good afternoon, everyone. Really quickly, we're going to be transitioning over to the afternoon, our final breakout sessions for the day. If you are participating in the breakout session for Plan Year 2020 registration and training, that's taking place here in this room. You can also check your folders for the breakout sessions back in the conference center for those who were here this morning. If you're not sure where the conference center is, please stop at the registration table and someone out there will assist you. And I also want to remind you, in your folders, there was an evaluation for today's summit. If you can please fill that out before you leave and place that on the registration table out front, we would greatly appreciate it. And then after the breakout sessions at 3:45, please come back here. We're going to have some closing remarks from leadership. We'd like for you all to be a part of that. Thank you.